Hey everybody, welcome to week 7 of pregnancy and a little bit into week 8. Everything's been going great. My biggest symptom still is being so extremely tired, which I'm trying to kind of deal with. It's not always the easiest, but my husband's really picked up a ton of slack around the house, so that's been great. Um, I've had a little bit of breast soreness as well, which I have kind of just dealt with by putting like hot water bottles just on my chest, and that does seem to help a lot. That's really it. I still get some uterine pain, some stretching, things like that, but I'm not having a ton of morning sickness. I've had a couple, especially these past 2 days, been a little bit sicker, but still nothing. It's not, I just feel like my stomach's upset. So it's been really great. I went again for an ultrasound on Wednesday. Everything looked great. The baby's heartbeat was 168 beats per minute, and it looked more baby-like than it has in the past. It's starting to take the shape of an actual baby. And it was really great to see. It was a great reminder of all this happening. With Nate, I definitely did not have this many ultrasounds. With Nate in the IUI, I think I maybe had 2 early ultrasounds before like maybe 12 weeks. And that was it. With this baby, I've already had probably 5 or 6 between the two facilities. With the IVF, my fertility doctor didn't do IVF, so we had to go to a different facility that's like an hour and 20 minutes away. And so I've had a couple ultrasounds up there, and I've had a bunch of ultrasounds down here, just because they're monitoring, because I had the bleeding to make sure everything's okay and everything. I've never bled again. Everything's been perfect. The baby was measuring at 5 weeks, or gosh, 5 weeks. The baby was measuring at 7 weeks and 6 days, which with frozen embryo transfers is normal. Usually it measures like a day or so behind, because I've read because it takes the time for the cells to regenerate. So totally normal. Everything's normal there. They so I went to the doctors and we talked right after my ultrasound appointment. She said everything looks great. They talked about me starting to get an OB. And there was a debate over that because with Nate, I used a doctor in the office where my fertility doctor is. It's not the IVF fertility doctor. And we argued a lot. We did not see eye to eye on a lot of things. And I feel like it was not a situation I wanted to get back into. However, I really like that office because that office is in the hospital where I work, so it just makes it very convenient for appointments my office is like a floor down and 20 feet away. So it's very easy to have appointments there and not miss a ton of time. So I really wanted that off. So I talked with the fertility person about it, and she said that since it had been a couple years since I had seen the other doctor, they could create me to be a new OB patient. And so I could see whatever doctor I wanted. So I got to switch, and I have had a lot of feedback since I work in that hospital now on, which doctor, and I've just learned a lot more. So I think I'm really going to like the doctor I have, and if for some reason I don't, then, I will switch. It's not that big of a deal. So everything's going really great. Like I said, I got the ultrasound. I have my ultrasound pictures at work, so I don't actually have them here, so I can't show you. But it did actually look like a baby this time. And I could see the heart beating, and it was wonderful. So it's never, it's been, I kind of thought after Nate things would be similar, but it's been completely different this time around. Obviously doing IVF is a huge, it's much more of a commitment than like an IUI was. It's every step of infertility you get in deeper. It's just much more of a commitment. It's a much bigger progression. So, and then of course with the bleeding and the many ultrasounds and things like that, I've been able to see things kind of as they happen, so to speak. And it's been interesting from seeing what I could barely see as a bleep of a heartbeat to, this last ultrasound, it was 168 beats per minute, and it was just, flashing away. It was an amazing thing. So Nate continues to be super excited. We talk about the baby all the time, and he says some pretty cool things, and it's just very interesting to watch it through his eyes, so to speak, to see how in a way I was kind of when we decided to go back through and do the IVF, or to use our embryos, the frozen embryos, I kind of worried about Nate being so much older. By the time this baby's born, Nate will be 5. and so there will be a 5-year difference between them. But at the same time, like, now I really kind of like it because he understands so much more. I mean, I did the actual IVF stuff, the IVF procedures, where they, did the retrieval and everything when he was 2. And obviously he didn't understand anything, but now we can actually have conversations with him about what's happening. I'm wicked congested. And show him pictures of what the baby looks like and show him some things online. And it's very exciting to view it all from his eyes. So as an update from the room, we've not done anything. I have been so exhausted that my husband has been picking up the slack as far as cleaning and cooking and things like that. So we haven't really had much time. I do believe our plan this weekend is to work on the room a little bit. That's outside of Nate's, actually, because we have to get that room finished in order to do the baby's room. And I will do, maybe I'll shoot some video this weekend of it to kind of show you guys what's happening and where we're headed with all this and show you all that. So that is that. I hope everyone is having a really happy new year. We obviously are having an awesome new year. And I hope everyone's having a really great 2016. I hope it's wonderful for everyone. I'm sorry, I'm so congested. And I will talk to you guys all in a few days. Bye.